Well, welcome back. I'm with one of our sponsors today, Ogden Clinic. We have Dr. Nadim Bikhazi with us here, ear, nose, and throat specialist. Thanks for coming in.
Thank you so much for having me.
We are talking about how spring allergies can lead to future sinus problems. Now, you wouldn't know it by looking outside right now.
That's right.
Because we've had the snow.
It's changed.
But those spring allergies are in full force right now.
Oh, before the snow that recently hit, we had about 10 to 15 allergy sufferers daily in my clinic. The springtime for allergy sufferers is a love-hate time.
It is.
They love the beauty, but they hate the symptoms.
What are the main culprits?
So in the springtime, tree pollen. So essentially when that wind starts kicking up on dry, windy days, and those beautiful
2 days
blossoms.
ago. Whoa.
Yeah.
Right.
And the symptoms are prolific: nasal congestion, itchy eyes, runny nose, sore throat. So that's when the allergy sufferers seem to worsen.
So we hear a lot about mold and pollen and airborne, but what other types of allergies do you see most in Utah?
You know, indoor ones you'll see a lot.
Really?
You'll see animal dander, mold, as you mentioned, you know, in more moist and water damaged areas.
Right.
But indoor ones, dust mites, feather, animal dander. It's important where you sleep to keep that free of those things, because you don't want to be spending time in bed with all the antigens that are triggering your symptoms.
Yeah, that's absolutely true. Man, getting to bed and good night's rest can be tough, can't it? What are the symptoms of allergies, and how can you tell if it's allergies or a cold?
Yeah, that's a great question. So the main differences are really the severity and the time course.
Okay.
So a cold tends to be more severe, severe sore throat, fevers, versus allergies, which are more low-grade symptoms, itchy throat, itchy eyes, stuffiness. There are some similarities in symptoms. And then the time course, a cold should be gone within about 14 days, whereas the allergy sufferer will suffer all season long.
A whole season, exactly. Yeah. All right, so how do allergies affect people with asthma and other breathing conditions?
You know, that is probably one of the biggest secrets out there that people don't know, is that it can really worsen asthma symptoms.
Really?
So if you tend to have wheezing, it's going to be worse during those allergy seasons. So you definitely want to be working on prevention. You don't want to get behind the 8 ball where the asthma or the allergy symptoms are worse. Prevention would be, number one, avoidance. If you can exercise early, close the windows, don't let that pollen get in.
Right.
And then medication, antihistamines, nasal sprays like nasal steroids, and getting your asthma inhalers going early so you don't have worsening.
Yeah, stay one step ahead. Okay, can you suddenly develop seasonal allergies as an adult, even if you didn't have them as a kid?
You know, we get that question a lot.
Yeah, because it seems weird. It seems like you just have them forever or you wouldn't.
Yeah, Debbie, we get that all the time, like, why now?
Yeah.
In fact, I was driving up here and Sid asked me the same question. One of my friends, she said, why did I get it recently? A lot of it has to do with change of environment. If you've moved to a new city, moved to a new home, our immune system changes. So sometimes we didn't have problems and then our immune system changes and we're exposed to new things. Those are the most common reasons.
All right, and what are the best treatments for allergies?
Yeah, so antihistamines are broadly used. Nasal steroids temper down the nasal response.
Okay.
A lot of people reach for over-the-counter products, and they need to be aware that the decongestants have a rebound effect, so avoid those if you can.
Okay.
And the newer generation products like leukotriene modifiers, one of the names is Singulair, work on a different pathway. They can be used as an adjunct to traditional allergy therapy.
All right, and what kinds of medications and creams should you have on hand?
Yeah, so a lot of times people in the house will use nasal saline spray. I think that's probably one of the most effective and one of the cheapest ones. It's just nasal rinses.
Right.
If you've been exposed outdoors and you have pollen on you, you want to get your clothes off early, but also rinsing your nose, putting eye drops in, get that out of your system before you go to bed will be some of the more common ways to prevent it at home.
All right, and we talk about when does allergy season really end. It never does for some people, and then it changes, right?
Yeah, so there's two broad categories. One is seasonal, where it kind of blends from one season to another, and the other one is perennial, all year round.
Yeah.
So essentially, it'll start off in March and go all the way to the first frost in October.
Oh man, that's miserable.
It's miserable for sufferers.
Yeah, right.
Never stops.
OgdenClinic.com, or the numbers on your screen, 475-3075. You guys have screenings. You can help anyone out who's suffering.
Get tested. That's the main thing.
Then you
prevention.
know. That's right. Ignorance is not bliss. Thank you, doctor.
Thank you, Deb.
All right, let's